You have mentioned that you read so many books, including Grace, Lippincott, Guyton, etc. And I've heard that medical colleges, especially private ones, are very strict with respect to attendance and stuff. So, how did you find time in reading all of these books while making notes and all? How was your day? What did you schedule? How did you do this?
Yeah, at least in our college was quite strict with respect to postings and practical, not posting exactly, practicals. We used to have practicals in first and second year. With respect to practicals and theory exams and even attendance during the first and second year, especially. So, what I did was I used to attend my classes, the theory lectures and then the practicals 2 to 5, especially in first year. I used to come back, have a short nap around 1.5 hour, and then sit and start reading. So my entire focus was to read whatever has been taught today in the class. Suppose if we had one anatomy and in biochemistry class today, so I would just open my anatomy textbook, VD Chaurasya, and my biochemistry textbook, and would read whatever has been taught today. And that was the thing which was for that day. And I made sure that I do not have those backlogs, that suppose if I did not feel like reading, I'm not reading today. I made sure that I would read at least 1 hour, 1 to 1.5 hours daily, uh, after coming back to my hostel. So I the habit of daily reading made sure that I was aware with whatever is given in the textbook, whatever is given in the syllabus. So in this way I could make time with things. The consistency is very important. No matter if you want to score good in your profs or if you want to score good in your NEET PG exam, the only thing which helps you a lot is if you are very consistent. In that way, I mean, everybody is going to have backlogs. The medical literature is never ending. We can never read a book from cover to cover. But if at all you're consistent, if you constantly keep reading little, then in that way you will be at least familiar with the things in your textbook. It won't feel alien to you once you go for a revision or something like that. So that was about first year and second year. From third year onwards, we had started having clinical postings. So we had clinical posting from 9 to 9 to 12, I guess. 9 to 12 clinical posting and then theory lectures afterwards. So uh, the attend like people from third year onwards, the attendance is not very strict in our college, at least for theory lectures. And for clinical posting it was in certain departments, but but there was not very, I wouldn't say that the environment around was very studious. People were very interested. Again, it is a very personal choice. So but I made sure I was very interested. I made sure that I go and attend every posting, at least the clinical posting. I would go and attend along with 2 or 3 friends of mine. We would go and attend. We would, force the residents to come and take lectures and teach, and would go to the consultants and ask them questions. So I regularly attended all clinical posting. I hardly missed 1 or 2 days in any of them. But about theory lectures, sometimes there, like, we understood the pattern that what all departments are strict with theory lectures. So we would, go and attend the theory lectures of those departments, and the other ones usually might not take regular lectures. So during that time, we would get some free time. So I would either come back to my room or and start, maybe reading. And or what I used to do most of the times, I would go back to the hospital. So since I am from a private from a deemed university, I had a attached tertiary care center which does not have that very great patient flow. We have patients enough to learn as an you know MBBS graduate, but not a lot of patients, so that we can constantly practice and make sure that our clinical skills are very good. So what I did was, in whatever free time I had, along with one of my friends, we would go to the hospital. Like, suppose two of our theory lectures got cancelled between 2 to 5. So in that time, whatever posting we were having right now, we would go to the hospital, and we communicated with our friends who were posted in a different department, and we would ask them, अच्छा, you have this case, so please अभी रुक के रहना वहां पर, और सर को बोलना 2 मिनट रुक जाए, आई एम कमिंग. तो वी वुड गो देयर एंड वी वुड सी दैट. सपोज सर्जरी में ब्रेस्ट लम्प का केस आया, during our posting we did not have a breast lump case, but my during my friend's posting breast lump का case आया, so we would go to the surgery department and we would, we would ask the PG कि sir, let us do the examination, एक बार demonstrate करके दो sir, ऐसा करके. So this is what I made sure. I made sure one thing. See, what I believe that you always have a choice. A lot of my batchmates would crib that patient नहीं है, patient नहीं है, ऐसा college है, ये problem है. A lot of people would say a lot of things. I totally understood. I agreed with them that we had certain issues, कुछ problems थे. But I believed one thing. The day I stepped in my college, the day I stepped in a private college, I knew that I'm going to, lack in a few things. So I have two choices: either to crib about them or to do something. So I chose the latter. Ki now I'm going to do something. I will uh, I will make sure that I'm well read. Even if I will make sure that the lacunae which I might have in those clinical exposures in terms of patient, I will make sure that I'm very well read. I'm very nicely reading all the clinical examination textbooks or a theory textbooks. At least I'm theoretically strong. And whenever I'm getting a choice, I used to make sure कि I was on my resident's head कि sir case आए तो बताना please. If you get a thyroid case, please let us know. So, and even we did this thing also कि we had this 15 days summer break. From 15th of May till 1st of June, I guess. So I did not used to go home. Like me and my friends, like two or three of my friends, we did not used to go home. हम लोग उस टाइम पे हॉस्पिटल में जाते थे कि अच्छा पता है अब तो ज्यादा टाइम मिलेगा, वैसे स्टिपुलेटेड टाइम नहीं है 9 to 12. सो वी वुड गो टू द डिपार्टमेंट्स, वी वुड रिक्वेस्ट द एपीज एंड द residents ki sir please let us examine, or at least we are reciting the history, listen to it and tell us our mistakes, so that I just did not want to anything, I just want that I am at least being well versed with the curriculum which is defined by an MCA. I do not, I made sure कि हाँ इतना तो आना चाहिए as an MBBS doctor. And hence after that 9 to 5 time, whatever time I had in the evening, I made sure I make out at least 2 hours of time for textbook reading. I made sure daily कि हाँ इतना तो टाइम निकालना ही निकालना है. इसके अपार्ट I will see what can be done. Video lectures कहाँ पे adjust करने हैं, कैसे करना है. Suppose a lecture got cancelled, I am still in the lecture theater, so I would just bring out my earphones and open my notes and start watching a video lecture. एक डेढ़ घंटे में या 2 घंटे में एक lecture complete हो गया. So that time is now saved. I would now go to my room. I would read that topic from my textbook. So in this way, I tried to squeeze in a lot of time, and I made sure that I'm utilizing every minute. My only purpose, at least in final year and third year, I did not have this thing. I and I'll tell you, I whenever I watched those interviews now, हर नीट 2022 के बाद 2023 के बाद, I was very intimidated. I was like कि oh my god, इतना difficult होता, इतना पढ़ा. I have not even started. अभी तो थर्ड ईयर चल रहा है, अभी तो फाइनल ईयर चल रहा है. So what I made sure that अभी जितना required है अभी उतना करते हैं. Let me focus on reading my textbook first. Let me focus on my prof first. Internship में देखते हैं तभी क्या करना है. I'll make out something to कुछ तो टाइम निकल जाएगा, कुछ तो हो जाएगा. So it's about time utilization also. I mean, I'm not a kind of person who promotes that hustle culture ki nahi ekdam bilkul you have to do something 24 out of 24 hours a day. You sleep for 2 hours and then I do not promote it. I am a kind of person who needs 7 hours of sleep for proper functioning, and I made sure that I had those 7 hours of sleep till 10th of August. So that is something which is important. I did not compromise on my sleep too, but I made sure that whatever time I'm taking out for reading or for whatever I'm doing, I at least if I'm taking out 2 hours, I made sure I'm utilizing those 2 hours very nicely. That is the whole purpose. So उतना तो आपको करना पड़ेगा ऐसा करके. And you always have a choice to do something. You have to choose that what is important for you right now, prioritizing things, and making sure you are sticking to your small targets, making sure you are constantly doing something, you are taking baby steps, so it eventually comes down to what you want to do.